Have you ever felt something strange in your body, but ignored it because it didn't seem serious? Maybe your legs started hurting when you walked. Maybe you felt tired all the time. Maybe you noticed dizziness, chest pressure, or even cold feet. Most people brush these things off as just getting older. But what if your body is trying to warn you that your arteries are slowly clogging right now? And here's the terrifying part. Many people don't discover they have blocked arteries until they suffer a heart attack, a stroke, or collapse without warning. Doctors call clogged arteries the silent killer for a reason. Today, we're going to reveal 7 silent signs your arteries may already be clogged, signs many older adults completely ignore. Make sure you stay until the end, because sign number 7 is one of the deadliest warnings doctors say people miss right before a major cardiac event. Let's begin. Sign number 1, leg pain. When walking, do your legs start hurting after walking short distances? Maybe your calves tighten. Maybe your thighs ache. Maybe the pain disappears when you rest. Most people assume it's aging, arthritis, or weak muscles, but sometimes it's something far more dangerous. This condition is called poor circulation. When arteries become clogged with fatty plaque, blood struggles to reach your legs properly. Your muscles become starved of oxygen. Doctors call this condition peripheral artery disease, and it can be one of the earliest signs your arteries are hardening throughout your entire body. Think about that carefully. If arteries in your legs are clogged, there's a high chance arteries near your heart and brain may also be affected. And here's what makes this scary. Many seniors ignore this sign for years. They stop walking as much. They sit more often. They think, I'm just slowing down. But the real problem continues getting worse silently. Pay attention if your legs cramp. While walking, your feet feel unusually cold. One leg feels weaker than the other. Wounds on your feet heal slowly. Your body could be begging for help. Sign number 2, constant fatigue. Do you feel exhausted even after resting? Not normal tiredness. We're talking about deep, draining fatigue that makes simple tasks feel harder than they used to. Clogged arteries force your heart to work much harder to push blood through narrowed vessels. Over time, your organs and muscles receive less oxygen-rich blood. That means less energy for your body. Many seniors describe it like this: I just don't feel like myself anymore. This symptom is especially dangerous because it develops gradually. You don't notice it overnight. You slowly become less active, more sluggish, more breathless, less motivated, and because it happens slowly, it feels normal. But chronic fatigue can sometimes be one of the first warning signs of heart disease, especially if it appears together with shortness of breath, chest discomfort, swollen feet dizziness. Your body may be working overtime just to keep blood flowing, and if ignored, the next symptom could be far worse. Sign number 3, shortness of breath. Have you noticed yourself getting winded doing things that used to feel easy? Walking upstairs, carrying groceries, even making the bed. Many people blame age, but your lungs may not actually be the problem. Your heart might be struggling. When arteries clog, the heart can't pump blood efficiently. This reduces oxygen delivery throughout the body. The result? You feel breathless doing ordinary activities. Sometimes people experience tightness in the chest, heavy breathing, while lying down, waking up gasping at night, feeling unable to catch their breath. And here's something many people don't realize. Some heart attack victims never experienced dramatic chest pain beforehand. For many older adults, unexplained shortness of breath was the warning sign they ignored, especially in women. That's why doctors take this symptom very seriously. If breathing suddenly becomes harder without a clear explanation, never ignore it. Your arteries may already be dangerously narrowed. Sign number 4, dizziness or sudden confusion. Have you ever stood up and suddenly felt lightheaded, or experienced moments where your thinking felt foggy? This can happen for harmless reasons sometimes, but recurring dizziness can also signal reduced blood flow to the brain, and that is extremely dangerous. When plaque builds up inside arteries supplying the brain, oxygen delivery drops. The brain is incredibly sensitive to reduced circulation. That's why clogged arteries can trigger dizziness, balance problems, sudden confusion, memory issues, blurred vision. In some cases, these episodes may actually be mini-strokes, also called TIAs. Mini-strokes are terrifying because they often happen before a major stroke. Think of them as your body's emergency warning system. Some symptoms may last only minutes. Facial slurred speech, weakness in one arm, sudden confusion, then they disappear. And many people make the deadly mistake of ignoring them because they felt normal again. But that temporary episode may have been your final warning. Sign number 5, chest pressure or tightness. Now, this is the symptom most people associate with heart disease. But here's the problem. Movies have trained us to expect dramatic chest-clutching pain. Real life is often much quieter. Many people with clogged arteries describe it as pressure, tightness, burning, squeezing, heaviness. Some don't even feel it in the chest. They feel discomfort in the jaw, neck, back, shoulders, arms, especially the left arm. And sometimes the discomfort comes and goes. That's what makes people dangerous. They think, if it was serious, it would stay. Not true. Temporary chest discomfort during activity can happen when narrowed arteries reduce blood flow to the heart. The medical term is angina, and it may appear while walking during stress, after heavy meals during exercise, then disappear with rest. That doesn't mean you're safe. It means your heart is struggling, and if the blockage suddenly worsens, a heart attack can happen without warning. Sign number 6, erectile dysfunction. Most people never expect this one, but doctors say erectile dysfunction can sometimes appear years before a heart attack. Why? Because the blood vessels involved are extremely small. When arteries begin narrowing, blood flow problems often show up there early. That means erectile dysfunction isn't always just about aging. Sometimes it's a circulation problem, and circulation problems often point back to clogged arteries. This is why doctors increasingly view erectile dysfunction as a cardiovascular warning sign, especially when it appears suddenly or worsens over time. And ladies, this applies to women too. Reduced circulation can also affect arousal sensation, energy levels, overall sexual health. The body depends on healthy blood flow for everything. When artery is clogged, many systems begin failing silently. This is why cardiovascular disease is so dangerous. It doesn't always announce itself loudly. Sometimes the warning signs appear in places people never expect. Sign number 7, cold feet or slow healing wounds. This final sign may seem harmless, but it can be one of the most serious warnings of all. Take a look at your feet. Do they often feel cold even in warm weather? Do cuts or sores heal slowly? Do you notice skin discoloration, weak pulses in the feet, numbness, tingling? Poor circulation caused by clogged arteries can reduce blood flow to the extremities. Without enough oxygen-rich blood, the body struggles to heal itself. And for some seniors, this progresses into severe complications. In extreme cases, infections develop, tissue begins dying, amputations become necessary. That's why doctors never ignore circulation issues in the feet, especially in older adults with high blood pressure, diabetes, high cholesterol, smoking history. Your feet may reveal problems happening deep inside your arteries. And the scary part? By the time symptoms appear in the feet, artery disease may already be advanced. So what actually causes this? Over time, fatty substances called plaque build up inside artery walls. This process is called atherosclerosis. The arteries become narrower, harder, less flexible. Eventually, blood flow becomes restricted, and when plaque suddenly ruptures, a blood clot can form instantly. That clot can block blood flow completely, causing heart attacks, strokes, sudden death. The biggest risk factors include smoking, high blood pressure, diabetes, high cholesterol, obesity, lack of exercise, chronic stress. Poor diet and age itself increases risk dramatically. That's why seniors must pay close attention to these silent warning signs. Now, here's the good news. Your body has an incredible ability to improve when you make healthy changes. Doctors often recommend walking daily, eating more vegetables and fiber, reducing processed foods, controlling blood pressure, managing blood sugar, quitting smoking, sleeping properly, reducing stress. Even small improvements can help circulation and heart health. And if you already have symptoms, getting checked early could literally save your life. Tests like blood pressure checks, cholesterol tests, ultrasounds, heart scans can detect problems before disaster strikes. Remember, many people who suffer heart attacks had warning signs for months or years. They just didn't recognize them. Your body whispers before it screams. That leg pain, that exhaustion, that dizziness, that shortness of breath, they may not be random signs of aging. They could be warnings your arteries are slowly clogging, and ignoring them could be the most dangerous mistake you ever make. If you learned something from this video, make sure to subscribe and turn on notifications because we post important senior health videos every week designed to help you stay healthier, stronger, and safer after 60. And tell us in the comments, which of these warning signs surprised you the most? Stay healthy and take care of your heart before it's too late.